Over time, hydronephrosis leads to destruction of the normal kidney tissue. The small pyramids and triangles will disappear. Finally, the bladder generally has a smooth contour. Which structures are we looking at in the upper left image? Please pause the video now and encourage responses. In this case, there is a blockage in the urethra, which allows the bladder to drain urine. So there is a backup of urine leading to enlargement of both the kidneys and the bladder. Notice the pyramids or ridges indicating the kidney and the smooth contour of the bladder. This image also shows how the spine can create a dark shadow that makes it appear as if the kidneys and bladder are connected. They are not connected. What do you see in the lower right image? Note that this is not a transverse image of the fetus. It is a coronal section, which divides the body into a front and back half. Please pause the video now to encourage responses. Here we can see two enlarged kidneys with hydronephrosis. The pyramids or ridges along the dilated renal pelvis of each kidney are your clue that these are, in fact, kidneys. The bladder may also become enlarged, often because of a blockage. If the fetal bladder appears unusually large, rescan after 30 minutes. If the bladder is still large, there's probably something wrong, and you should refer to the hospital. Please pause the video now to look at these images as a group and ask what the structure is and whether it appears normal. In both images, the structure is a fetal bladder. The bladder on the left is normal in size. Note the smooth contour and absence of pyramids or ridges like we saw in the kidney. On the right, you can see how the bladder takes up much more space in the abdomen and appears to be enlarged. Something is curious about the enlarged bladder in the right image. It appears to be connected to another dilated structure. This structure is called a keyhole, which indicates that posterior valves in the urethra have created a urethral blockage, leading to an enlarged bladder. There is another condition that can appear similar to hydronephrosis, but is quite different. In this image, we see a cystic structure within a kidney, but this time it is not hydronephrosis. Notice that there is a septation within the cystic structure. This is a cyst within the kidney, similar to the cysts that you might have seen within the ovary. Inside a kidney cyst, we don't see the pyramids or ridges that we identified with hydronephrosis. Now, let's use what we have learned to study a few cases of blockage within the genitourinary tract. Case number 1. In this image, we can see 4 cystic spaces. What are they? Please pause the video now to ask a volunteer to identify the structures in the image. First, we see the heart underneath the ribs. Both kidneys have hydronephrosis, but in this case, the pyramids and ridges are difficult to see because the condition has gone on for a longer period of time. Nearly all of the normal kidney tissue was destroyed. The bladder is the structure located closest to the baby's feet. Case number 2. This is an interesting image. Here the white calipers measure the length of the kidney, and within the kidney is a large cystic structure. Please pause the video now to discuss what this might be within the group. The answer is that this could either be a kidney cyst or it could be hydronephrosis that is chronic with a loss of the pyramids and ridges. Notice the normal kidney tissue that is present. Case number 3. This is a case with several cystic structures in the image. This image looks different because it is a cross-section of the abdomen, and we don't have the benefit of seeing the full length of the kidney to gather more information. What do you notice about all of the cysts in the image? They all seem to have a smooth contour. Please pause the video now to ask a volunteer to identify the structures in the image. The largest cystic structure in this image is the bladder, which is in the midline. The cysts located to either side represent hydronephrosis of both kidneys, which are located close to the spine. Case number 4. Here is an image from a younger fetus than we have seen in the prior cases. We see 3 dilated cystic structures. Please pause the video now to discuss what the structures might be as a group. The answer is that the large cystic structure is the bladder, and the smaller ones are likely kidneys, given their location next to the spine. There's likely a urethral obstruction, causing enlargement of the bladder and hydronephrosis. The last fetal abnormality we will discuss is cystic hygroma. This is a condition caused by a blockage in the lymphatic systems that usually appears as a cystic mass at the back of the neck or head. Often we will see other abnormalities together with this condition. Most fetuses will not survive. Cystic hygromas usually appear in the second trimester, and the masses can range in size. The mass is usually cystic, with thin lines or septations in the cyst. This condition is often seen with oligohydramnios, or low amniotic fluid. These images show cystic hygromas behind the head. Please pause the video now to have participants point out the cystic hygroma and associated features. Here we have labeled the cystic hygromas and pointed out the thin lines or septations that are often seen within the mass. There may also be low amniotic fluid or oligohydramnios in the case shown on the left. Here are 2 more examples of how a cystic hygroma might appear in a young fetus. In the left image, you can see a cystic mass behind the fetus's head. In the right image, you can see that the cystic hygroma extends behind most of the fetus's body. Let's practice using ultrasound images to identify these 4 abnormalities. Please look at image number 1 and guess which abnormality is seen in the image and name one associated feature. Please pause the video now. The answer is that the image shows an enlarged kidney, which we call hydronephrosis. The pyramids, or ridges, in this image indicate that this is a kidney. The structure with a smooth contour is the bladder. Hydronephrosis indicates a blockage in the urinary system. Now please look at case number 2 and guess which abnormality is seen and name an associated feature. Please pause the video now. The answer is that this is a cystic hygroma. Thin lines or septations are seen within the mass at the back of the neck. Please guess the abnormality in image number 3 and describe an associated ultrasound feature. Please pause the video now. The answer is that this is ventriculomegaly, which is an enlargement of the ventricles in the brain. A commonly seen ultrasound feature is that the choroid plexus appears to be dangling in the fluid. Now please name the abnormality in image number 4 and an associated feature. Please pause the video now to discuss within the group. The answer is that this is fetal anencephaly. There is an absence of fetal brain or skull above the level of the orbits. The orbits, or eye sockets, often appear prominent, like frog eyes. Let's review the algorithm for ultrasound as it relates to identification of fetal anomalies or birth defects. If a pregnant woman comes to your health center for a screening ultrasound at 20 weeks and it is normal, encourage her to return for another screening ultrasound at 32 to 36 weeks. If you suspect a fetal anomaly at any gestational age, send her to the referral hospital to be rescanned. The obstetrician at the referral hospital will decide when the patient should come back for antenatal care and a repeat ultrasound. Let's review the key points. There are many fetal abnormalities, but you should be familiar with anencephaly and exencephaly, ventriculomegaly, hydronephrosis, and cystic hygroma. If you identify an abnormality, refer the patient to the hospital, even if you are unsure. If a baby is born with an abnormality that you did not identify by ultrasound, this does not mean that you made a mistake. Many abnormalities are difficult to identify by ultrasound, so don't assume you made a mistake if one of your births involves an abnormality. Review questions, true or false. All anomalies can be seen on ultrasound. The answer is false. Many anomalies cannot be identified on ultrasound. What is the condition called where a fetus has no skull or visible brain above the orbits? The answer is anencephaly. Does ventriculomegaly affect the fetal brain or the fetal kidneys? The answer is the fetal brain. What can happen if there is a blockage in the urinary system? The answer is that urine can back up, causing a urine collection in the kidneys and kidney damage. This is called hydronephrosis. What is a cystic hygroma? The answer is a cystic mass at the back of the neck caused by a blockage of the lymphatic system. Thank you for your attention and interest in learning pregnancy ultrasound.